and a warm welcome to all our esteemed panelists on the dais and all our industry and fraternity members from across the industry value chain present for this session. It's a very interesting session which talks about how the digital health has evolved in the last couple of years and leading us to a stage where we are looking forward that how do we move from silos to intelligence, unlocking the power of health data and AI. I don't know how many of you here know that the digital health that you see in the current avatar started way back 2 decades back in the 50th World Health Assembly in a forum where WHO had moved a resolution for each country members to embark on setting up a e-health plan. And this has been 2 decades since then that the e-health has moved to m-health, moving on to the digital health. But it was a cornerstone in way back in 2020 when across the globe the health system realized the importance of the digital health and AI, that how the AI and the digital health can really enable to integrate the health system that exists, a fragmented one. In the last 5 years in India, the Ayushman Bharat Digital Mission has embarked on creating a conducive healthcare infrastructure and ecosystem in India, right from ABHA records to HFR, HPR, to creating a digital ecosystems, enabling the policies and the guidelines. In early this year, our Honorable Health Minister had launched two big policies, which mainly talks about that how do you bring the artificial intelligence in terms of the governance, yeah, and also about how the digital health and health data lab can be created through Sahi and both. Yeah, it's also launched Abha 2.0 or Arogya Setu 2.0, which mainly talk about earlier Abha app that we had. The importance of digital ecosystem and AI is to look forward to bring the islands of data that exist in the health system across the value chain. When you look at public health system, there are more than 50 public health programs. You have thousands of private hospitals and you have thousands of public health sector hospitals and facilities. But above all, you have 140 crore citizens who carries the health data with them on every stage of their episodic treatment and the healthcare. The idea is to how do we bring the silos of this data together, the island of data, and the health system that exists in the fragmented way, bringing together through enabled digital health and AI. And to discuss on this, we have esteemed panelists on this platform who will bring a perspective from across the value chain. Let me start with Dr. Sushil. Dr. Sushil, you've been part of this entire journey in with the digital policies, governance, the ecosystem that you have created. How do you see this as a journey, and what has been something innovation and the policy decision that government has taken, and what are the way ahead on this? How do we bring and move from here to the next stage? Over to you.
Yeah, good afternoon. And most probably it is the last sessions. Definitely everybody they are exhausted. But it is very interesting topic what we have right now. Thank you to Financial Express to inviting me in such a wonderful sessions. See, last 33 years I am in the IT in healthcare. I've seen the whole journey. The first in the country, we have a large scale of IT implementation in AIMS New Delhi in 1988. At that times, many people they speak that why computer is required in healthcare. Today's you'll find each and every healthcare services you'll find the computer at their own working place. Then what government initiative I am giving just one brief. 2005, first committee has formed by the Ministry of IT to that how to make digitization of health record. And the document is already into public domain. You can check it in Ministry of MIT website. And that was not sufficient. It is very preliminary documents, and they are planning to make a EHR record. EHR record means each citizen supposed to have a single medical record across all the places where he has treated to be accumulated in one place. But that was not sufficient. That document is not sufficient. Then they thought this is not our domain to do it. And same work has given to the Ministry of Health. And they form a committee. I was the member of that committee. And 2011, we have another set of documents. It is called EHS standard documents. Parallelly, we have another set of documents. It is uh, MDDS, metadata and data set. But when you'll find that this document is not sufficient, it is lacking the privacy, security, and confidentiality. So another version has come EHR document. It is in the public domain. You can get it, and we have put it that one. So whole setup it was there, and it is been notified that each and every hospital they have to adopt it, but adaptation was totally negligible because the cost is involved. Then 2016 government had taken a decision that if you go for that, huge investment is required. And same pattern, it has failed by the US, failed by the Australia, failed by the Singapore. Only in the world, in the single medical record office, citizen is available in Taiwan and Hong Kong. And many people they are trying right now. So government what he has thought it, let's be patient records supposed to be patient centric and give how you can give the service to the patients. Then ABDM has been created. And ABDMs, you must have a AVA ID and all these things. The different blocks are there, they have created it. But the main issue of this one is that the data which is being generated in which hospital or which location, in which organization, it will be laying there. And patient is empowered to access that his record. As per law, patient is owner of his old health record. Other people, those who are generating, they are custodian. So this is the digital journey of the government of India. Next government was started that recently in last AI summit, they have launched the SAI standards. SAI means strategy for the artificial intelligence in healthcare in India. But the document, what if you go through it, many things it has been there, but many things it is not been there. They have defined the robust governance. Majority of the hospitals do not have their data governance, and the AI governance is far away from there. Data governance it is not in place. Second part is that secure the digital infrastructure. You must have seen the vulnerability of the digital infrastructure of in healthcare is very high as compared to any other domains. Last year, it has increased by the 24% if you compare to the previous year. Third is the workforce capacity. You build up if you ask that I need a ML developer who can develop my LLM, you'll get hardly find the right people in the industry. Fourth one is the research and responsibilities. Do a lot of research work which can be encouraged to the startup to work with you to develop the models to implement across the country. It is the beginning of this one. For this, government has already been allocated nearly 1,000 crores for the AI development in healthcare. In health, sorry, 1,000 crores. It is in the across all the domains, and 937 crores has allotted to the healthcare, and it has given to the Indian Institute of Science and AIMS New Delhi. And AIMS New Delhi has designated as Center for Excellence in Health for AI development. And 300 crores it has been given to the AIMS New Delhi. This is the things what we have. I have. I hope I have answered my questions or
Yes,
anything left.
yes. Thank you, Dr. Sushil. And you've been part of this entire digital health policy advocacy design over a period of time, and you've seen the journey and also have an idea about that. What's a government view of how this entire digital health and AI policies and the advocacy will shape in the coming years. and which is in the right direction towards bringing the silos of data islands together and integrating the entire health system over a period of time. Let me bring in Rajesh. Uh, Moving away from the health system, even at a hospital level, there is an island of data that sits across the hospital information system, EMR, ERP system, CRM, and other aspects. How important it is to bring this data together for the clinical intelligence, the clinical decision support system, and enabling the doctors and above all the patients.
Thank you. I am Rajesh I'm a Chief Finance Officer for Rajiv Gandhi Cancer Institute and Research Center. But for this particular question, I would become assistant to a CIO, and I will explain with very simple words as to what we are talking about, the data and the data lake, and how the entire AI digital journey and what happens, and how does a CFO looks into it, because you have to be an integral part of the entire system ecosystem, because it is very costly. First of all, AI is not any digital transformation starts from the cost of the consultant to the final implementation and gestation period when it starts getting results. So I would say, first and foremost, as we all know, in the healthcare, the datas are fragmented and sitting across various modules. So typically we have HIS modules for the doctors, for the front office, patients, billing. So one and most important thing is the and then there you have reports, packs, reports. Then you have other kinds of clinical data setting various modules as well as various reports. So first and foremost thing, what the IT people technically say is to create a data lake. A data lake is nothing but a server or an independent server where you enter the entire data which you have across various functions through the help of IT, and you clean that data. So the cleaning of data basically means that there should be a data which should have a single source of truth. So single source of truth for us in the healthcare would be the patient registration number. So everything should be a link to a patient registration number, and then there would be a string of all the datas of the patient. So first and foremost thing is the cleaning of data. Now, in the IT booming sector, all this involves a lot of cost and time. So typically, when you start this entire process of integrating the data, cleaning the data, and putting it into server, it would involve a cost of almost 2 to 3 crores for us, 500 bedded hospital, and it will take at least 1 year to clean your data. So if the base part is not clear, then you cannot move to the next steps, because in India, I would say the HIS system is fragmented. There is no standard software like SAP. So when you come to the healthcare, then you will look for the outcomes. So with this data, there are various priorities which every people would have. The clinicians would want their data to be done first, or whatever may be the reports to be generated from that, they want their priority. The front office and the marketing team wants their priority, and third would be the finance would be looking for various kinds of data from this data. So again, you have to prioritize, and everything boils down to the time as well as the costs. So there are services available, but it involves a lot of patience and lot of investment.
And definitely integrating the entire system across hospitals is a big challenge, and bringing the entire, the islands of data that sits across the various systems that you spoke about is also a long-term investment. A lot of efforts are required. A lot of, patience is required to do this thing. Let me bring in Abhishek, who has worked across the value chain through digital enabled platform, the data that not only moves within an organization but across the providers, right from the value chain. How critical it is from a patient's perspective and bringing this data together, especially for the improving the care to a patient.
Absolutely. Again, thank you for having me here. Just quick background of context is I run a virtual first healthcare business across India, UAE, and Saudi. And effectively, what we do is we work with about 2.5 million lives, working with insurers to help patients get better, convenient digital first healthcare access with a full stack approach where we have teleconsults, clinics, pharmacies, labs across the spectrum through a unified patient experience. Uh, what we're seeing is the patient isn't waiting, right? So all of these are real challenges in the healthcare ecosystem. The patient on the other side is finally empowered. 10 years ago, you could call the patient desperate. Today, the patient is empowered. They are using LLMs, let them hallucinate, they're still using LLMs. They're coming in with smart questions, with better diagnosis, and asking, uh, you know, demanding rather for personalized attention to care. And this is happening and it's real. And we're actually enabling it because we're coming and saying, why shouldn't the patient actually do that? And traversing back to what that means for the healthcare system, if 50% of us or 50% of India can't even get access to basic diagnostic tests, we've got a long, long way to go, right? Millions of healthcare workers shortage. We are not training ourselves or labor arbitraging ourselves away from this problem. We have to fix it. As you rightly said, the data sits in islands, right? The single biggest problem that we saw as a practitioner was the issue wasn't there isn't enough data. Actually, there's too much data. That's a reality, right? It's just in too many different places. The one connective tissue is the patient. So things that don't cost hundreds of crores is empowering the patient to go access their data. Number one. So we just went the other way. We said, forget all this nonsense, it'll take forever. Let's go and actually design it around the patient. Let's empower the patient with the ability to get that access. And incredible things have happened. Obviously, it's made the patient more confident and it's made the patient more demanding, but it has come at the delight of better personalized care and better personalized attention. And the other model that we chose was data is in silos, but that is how the healthcare ecosystem has been operating for hundreds of years. So why can't we augment the physician today? Even if we didn't connect a single additional data set today, the patient, augmentation of the physician, which is ambient AI, is a clear winner, right? When you can document, you can get access to all this contextual data, you can pull data from the EHR. That's available today. Yes, it's in silos, but the hundred millions of physicians are making hundreds of millions of decisions today with just that data, nothing more. So instead of waiting for a ubiquitous healthcare system to come together, we chose an approach of saying, let's enrich the data you already have. Let's empower the patient with more access to data and ask more insightful questions. Let's add ambient AI to be able to ensure that we are able to be the physician's assistant and actually give decision support. And through that process, can we make healthcare better today? We've been really fortunate that we've uh, been able to do this because we have a full stack approach. And that's allowed us to be able to empower our clinicians so that they have what I fondly call the Iron Man suit that every doctor deserves, and a Jarvis inside. Because why have Avengers operate just in the fictional world when you can bring it back to healthcare? And at the same time, how do we empower the consumer to take a better charge of their health? Because they're capable of doing things, as Dr. rightly said, right? They are legally empowered to be the holder of their data. So why not empower them while we wait for the ecosystem to come together? Because the real answer is the public rails, right? I mean, we were fortunate to live in a world where UPI. I mean, I was born when there was no UPI, and now UPI is ubiquitous. And to see the financial rails of our entire country come together on a public financial infrastructure, there is nothing that gives me. I mean, gives me all the confidence in the world that this is going to happen for India on the healthcare side. And when it comes, you still need to layer on top, because infrastructure is not outcomes. You're still going to have to do the rest of the work. So we just chose to take a step in that direction, and we've been really fortunate to see incredible outcomes as a result.
And there is one set of data which still remains very far from this, in terms of the integration with the digital care, is the data that is generated on a day-to-day basis at home, especially through the medical devices and the pharma, the digital therapy that exists at home. the medical devices that you use for the blood pressure monitoring, to your weighing machine, to your sugar monitoring, to a lot of other things that you do, the data that get generated at the bedside, the data that get generated at home on a daily basis often goes unnoticed or unrecorded in the health system the way it is designed. So if you pick up any of the patient who's facing a long-term chronic disease, the most of the data, whether it is their lab records or their daily recordings that they get from a medical devices, is often not recorded. And that remains a challenge in the health system, that how do you bring the day-to-day data in the integrated way with the provider data, with the patients, to provide a better care to the patient. Let me invite Atun. You worked in pharma and medtech sector. How do you see connecting this data, the entire silos of data that sit here, with the larger ecosystem, and how it will benefit the patient?
Sure. I think great question, Lalit. I think see, these data are being collected today, and these sits in silos, and not only silos, these are fragmented data. All data that exist through your home care devices, or the data being collected by the medical device manufacturers, are very fragmented and not standardized. So the first thing that needs to happen is liberation of this data and standardization of this data. If everybody can follow the fire standard, it's not new, but nobody is following diligently. If everybody can follow that, a great thing can happen. One, you have data that is standardized. Everybody have access to the data, right from doctor, who at his fingertip can tell what the patient is looking for. For patient, they don't have to go through same test again and again in various different hospitals or provider segment that they go. And you have quality data to feed into your AI model, which will give you quality output, right? Then another aspect of this is, how do you federate this data and make it available to everybody? And you can do through, he spoke about a patient ID, but that has to be a unique digital ID, which kind of a digital healthcare passport for a patient, and he can go everywhere. The data is available. The pharma medtech companies, they can access the data to build their AI model. The providers or the payer segment, they can take their decision without delays. So these are the few things that are, I think should happen. One is standardization, and second, federation of the data. That will help everybody.
Thank you, Atun. Uh, Let me invite Dr. Sushil. Uh, what is the next for the public health system in terms of integrating the data? How do they should move towards this journey? And also keeping in mind the governance, the privacy part, the entire trust part of it, because the digital health and AI also exposes you to a lot of compliances, the risk that existed, which healthcare systems and healthcare providers are still in an initial stage of understanding it, what we've seen compared to other industries. So how do you see the journey for public health systems on this roadmap?
Yeah, it is a very difficult question for me. See, when we are talking about AI, without data, there is no AI. And second part is that the concept of treatment has been changed based on our own technology. Now we are talking about 5P, 4P. 4P means we need a personalized, we need a precision care, we need the predictive care, and we need the population care. And for this, definitely the technology is required, and AI will play a major role in this. See, if you compare with the tier 1 to tier 3 city, there is a lot of gaps is there, the availability of medical manpower. As per the WHO, is supposed to 1 is to 400, one doctor in 400 populations. Right now we have around 1 is to 1500. This is the gap, and we have to reduce the gap. Only one option is there, that is the technology. Technology means AI. AI is one of the artificial brain which will assist you to give a precision healthcare. Precision healthcare means it is personalized as well as accuracy of the healthcare. But before making a assistive AI model, the model is required to be trained properly. And in India, where to use AI, where not to use AI, I'll tell you. When we are talking about populations, one project we have developed, it is called ioncology.ai. And this project, it will give the early prediction of the breast cancer and ovarian cancer. When we have seen 2019, that what is the death rates in breast cancer, we have observed in the urban area, it is around 18% has increased. In rural area, it is about to be 7%. And every year, 2 to 3% is increasing. It is 19%, means next year it might be 21, 22%. And many of people must be knowing it, that detecting a breast cancer, it requires mammography. How many places mammography is available? If you will not find even in Noida, there is few hospitals. In government hospital, you will not find it. But if you do the preventive care, we can save it. That's why this project has come up. In this project, how to replace, not replaced, you can edit, you can say, that is the mammography. That's why one kit has been developed. It's a kit. We have developed a bra, and that can scan. And this is thermal scanning, it will do it. From thermal scanning image, we can do AI model to predict it, is there any tumor is there or not. And that has been used, and it can be used by the ASA worker and the Anganwadi people. When these Anganwadi people go to the villages, take the health status of the people. So in the clinical system, in their apps, they fill it, and the system will tell, the apps will tell you that whether he has to use the thermal scanning bra or not. You can check in your Google map what is the thermal scanning bra. You can get the photographs also. When you scan it, when you will take the clinical informations, it will ask that he needs the breast scanning or not. If it is required, then he'll ask that this is the thermal scanning bra, go inside where it come. When he'll come, the cable is attached and it will connect to the mobile smartphones and scan it. After scanning both the records, AI, the lightweighted AI apps, it will predict that is there any possibility of cancer or any malicious tumor is there or not. And you can't find it, it is 87% prediction rate. Means those who are leaving 0% predictions, right now we are getting 87%. Many people, they have told me that the false warning system, it may be there, but that is a 13%. When I am not getting 0%, when I am getting 87% success rate. So here you have to use the AI in the rural care. This is the things we have achieved, and this is the Indian made in India. It is already been tested in Punjab, Haryana, Orissa, Bihar, Karnataka. So this is the things it is there. So here you have to use the AI. But where not to use AI, I'll take 1 minute. Where you not to use AI. Last panels, before our this panel, they have spoken that we are using AI for the discharge summary. The discharge summary takes around, if the patient is admitted for 15 days, it generates around 80 to 90 pages if you give the handwriting. If it is a digital forms, it is again the same amount. To make the discharge summary, it takes around 2 hours to a junior resident. But AI will do hardly half a minute to generate the discharge summary. But whether you will use or not, in my cases, it is not to be used, because when the junior resident means he is doing the post graduations, and the patient records which is making discharge summary is a case studies for him. If the AI will be used, he will not be trained and he will not get the senior doctors, after getting the training from the junior resident, the senior resident cannot be a competent person to get it. So here it is required highly, but is not required to use in that cases.
Thank you.
Thank you.
Thank you, Dr. Sushil. I I'll quickly go to Dr. Rajesh. In terms of the hospitals, what is the journey on this entire digital ecosystem integration and AI roadmap? Quickly, 2 minutes on this.
Okay. So as I said, first of all, you should start the digital transformation journey to identify actually what are the areas. So typically, again, it would be some big fours would be coming and understanding your entire system right from the entry of the patient till the discharge of patient. So one is that you have to do a digital transformation journey. Secondly, then you have to find out key the second part what I said, the silos datas are in silos, that integration and having putting into at one common place. And the third part is what is the outcomes. So you have to prioritize outcome, because again, from finance point of view, I would say everything has a cost and time. The resources, the largest increasing cost in a PNL today is basically the IT cost, both in terms of capex as well as in terms of PNL. So these are the factors. Plus, one thing which I would like to say is that it is not only the one-time cost. You have to also keep in mind about the DPDP Act, how it will play around. Secondly, you also have to take into account the cyber security and things moving, because all is data and you are responsible for it. And then you have to work on keeping that data safe. So again, you have to take a lot of services for this SOC, as well as various kinds of audit testing on whether your data could be penetrated or not. So it is a very big thing where the outcome would come after 2 to 3 years, but you have to make sure that everything goes correctly, and it's huge investment of time and money for an healthcare.
Very true, Rajesh. Let me invite Abhishek. The most important element is how do you create value for the patients? And the most important thing is in this entire digital journey, we have to make efforts that how do you create awareness and acceptance with the patients on the digitizing their data, which is very important for a long-term care for a patient. So how do you embark on that journey, especially in the digital care and new age healthcare delivery models that are emerging?
Um, what we've learned so far is it's just first principles design thinking. So if you start thinking like a consumer, like a patient, just as an example, right? The way in which the healthcare has today, if you go to a pharmacy app, right? Uh, it's a carousel. It's like Amazon. You're shopping and you're trying to find the things to buy. That's not how healthcare is. The entire healthcare journey is actually the entire healthcare journey is conversational. You start with a doctor consult, you talk about your symptoms, and then the doctor diagnoses you, and then there is a prescription and there's a treatment pathway. Conversational UI was the first real breakthrough where we saw access and convenience shoot up and the consumer get more empowered. So, as we think about the patient, remember, at least we chose to remember that they are a patient second, they are a consumer first. And if you think like a consumer and you design for a consumer, you will empower the patient. That journey has led us somewhere, but to be honest, there is a long way before we're going to see this technology safe enough to be consumed by a consumer without the supervision of the human in the loop, the specialist, the doctor. So we truly believe that it's a combined effort. We keep empowering the user, we keep empowering the patient with more and more tools. Many of these are already available to the patient, and let's just keep adding more. Design them in a way that is convenient. For example, we design uh, medical records and family history where instead of you having to go to an app and click and upload and put it in an EMR, why can't you just WhatsApp? And as we started allowing our consumers to WhatsApp their medical records, WhatsApp their mother's medical records, their daughter's medical records, and just the system intelligently figures it out at the back. the consumption or and completion of medical records went through the roof at an unprecedented level. And then if that raw data can be cleaned and then used back for that in that patient, and then used obviously by the physician for every clinical encounter, now you've got a richer data set with cleaner insight to be able to go and empower both the user and the healthcare provider. So I do think that design plays a role, but I do feel that empowering the consumer without the doctor in the loop is very unsafe and is going to remain unsafe for some time. So we have to find the right balance.
Thanks, Abhishek. Atanu, last question for you. In this entire journey, how does the pharma and medtech companies, become a part of this larger digital health ecosystem? Because as we see, providers, public health systems, patients is becoming part of this. But at somewhere we feel the pharma and medical device companies also need to embark and be part of this larger ecosystem. There's a lot where in terms of the policy integrations, in terms of the shaking the hands between them. So what do you see the journey ahead on this?
Sure. So I'll answer in two parts. One for the medtech companies, right? They need to do four things, and some of it they are doing it already. First thing, they have to decouple the software from the hardware. From ages, they are selling medical devices where the software is embedded, and today's era that doesn't work. You need to have a digital ecosystem where over the air upgrade actually sends data to the system, right? That's first. Second, I'll again talk about interoperability, standardization of the data. That's must for medtech and pharma companies. Third, you have to move from descriptive analytics to preventive and prescriptive. What I mean by, if you tell to a doctor or nurse that patient BP has shot up to 110, doesn't mean anything, right? But if you tell that you see that this patient's data from last few hours indicates that he is going to get into a sepsis situation in 4 hours, that means a lot. And if you can tell that based on the monitoring, the dosage of certain drug can be brought down by 10%, which is prescriptive, that means a lot more. And the business model. A medtech OEM cannot sell a a robotic arm to a hospital in a capex model anymore. It has to be capex plus as you go or as you go pay model, where you need to have a digital surgery platform, and the hospital should be able to pay based on value or as a service, right? What I mean by using the digital surgery platform, are you able to bring down the complications, or are you able to bring down the readmissions, or your surgical throughput is going high, or so many parameters that are there based on that they should pay. So it's not a single prong approach, multi-prong approach. That is what I would say.
Great. Thank you, everyone. As I understand, the heterogeneity of this health systems provides a lot of challenges in terms of bringing the entire value chain together, but above all, the islands of data together in terms of the efforts. But what we believe is there is a definitely a use case and the importance of bringing all of these efforts together. And there is a surely a value for the patient that you will create if you do so. The journey of for this will be individual. Every organization will have to embark on their own journey, which is most suitable for them, whether it's a public system, public health system, whether it's a private sector, diagnostic centers, not-for-profit organization, and so there is no uniform cookie cutter roadmap for entire health system, but it's more of customized efforts depending on the investment resources and the willingness to drive through a long-term investment in this entire effort. But surely there is a value on embarking on this journey. We hope that the Indian health systems realize this and embark on this journey. Having said that, thank you very much, all my panelists on this dais, and to all my audience for being here, a very good listener. Thank you very much.